my audience. To begin, I would like everyone to close their eyes. Imagine you're sitting in a clinic. There's a doctor or nurse across from you that's holding a suction catheter, or maybe a loop-shaped knife. Imagine you've just had an abortion. Or you're sitting beside your sister, your girlfriend, or your best friend who's just had an abortion. Now open your eyes. How are you feeling? Imagine how they're feeling, or how the doctor or nurse across from you is feeling. Is it relief? Maybe guilt? You see, I can argue the pros and cons of abortion until I'm blue in the face. I can argue that you're taking away the choice of a woman over her body. I can also argue the flip side, is that you are going against the basic religious beliefs. But that's been done. Today, I would like to dive deeper into the emotional impact that an abortion has on a patient and those around her. I've personally seen the impact of an abortion on a girl that used to be my best friend. For our purposes, we will call her Beth. By the end of this speech, I would like you to see that when you choose to have an abortion, you are not only making a choice for your body, but you're taking on an emotional burden that you may not have expected to have. So to begin, we're going to look at the emotional impact that an abortion has on a healthcare provider. In 2010, the CDC was able to do an abortion surveillance, which is basically a surveillance the CDC does every so many years to look at abortion as the medical procedure, to see how many people have it done typically. In 2010, they reported that 756,651 abortions were performed. Clearly, that's a lot. But to put it in perspective, I want you to think about the state of Alaska. The entire state of Alaska has a population of 735,132 people. So in 2010, a greater number of fetuses were aborted than there are the entire state of Alaska in people. And that impacts not only the patient, but every one of those healthcare workers that has to face it. And a lot of these healthcare workers, in one way or another, have some form of post-traumatic stress disorder. I found an example that clearly could state this any more than a quote I found by Sally Tisdale, who is a nurse at an abortion facility. And her quote says, "I have fetus dreams. We all do here. Dreams of abortions, one after another, of buckets of blood splashed onto the walls, trees full of crawling fetuses." And that's just one abortion facility nurse. Imagine all the nurses and all the doctors that are impacted by having to do abortions on a daily basis. But along with that, we tend to focus more on the woman, rightfully so, that's making this choice to have an abortion. A lot of them commonly get something called post-abortion syndrome. Post-abortion syndrome is characterized by feelings of guilt, anxiety, feelings of numbness. They repress their feelings so they don't have to think about the emotional pain that they felt by making this choice. A lot of them avoid pregnant women and other children because it's a reminder of the choice they've made. Many of them even go as far as having depression and can sometimes re-experience the abortion based on sounds they hear, or typically having a pap smear can sometimes do it as well. Others fear that they are going to be infertile in the future and cannot have children any longer. And on the flip side, some want to get pregnant again in order to fill the space that was there from having the abortion. And then when they have children, some of them are unable to bond with those children that they presently have or ones that they're having in the future. And some even fear that the children they have now will pass away because of the choice that they've made. And the most extreme is some women develop eating disorders, and some even have drug and alcohol abuse problems. And it's not clear when or how many of the symptoms women will get from post-abortion syndrome, but it is highly likely that if they make the choice to have an abortion, they will have at least one of these symptoms that is an added emotional burden after making a choice like that. Unfortunately, I had to experience this firsthand in a girl that used to be my best friend. We will call her Beth. Beth got into a situation when she had a boyfriend and they became pregnant. Beth's boyfriend family said that if she had an abortion, they would pay for her car, they would pay for her schooling, and so she decided to have one, and he left. After that, I saw her spiral completely out of control. She was kicked out of her house. She turned to alcohol and drugs to try and numb the pain from having the abortion. And to this day, she's currently unemployed, and I haven't spoken to her in 2 years. All stemming from the choice she made to have an abortion. So you can clearly see firsthand experience that it does have an impact. But yet, there are people that say it doesn't. In 1989, the American Psychological Association actually convened, and they brought together a bunch of studies and a bunch of psychologists to look at whether or not there's actual evidence of post-abortion syndrome, and they could not find a trace of it. Now, they found that the most stressful time for the patient was prior to the abortion and trying to decide whether or not they felt responsible enough to have a child or if they needed to have the abortion, and found that having stress afterwards was actually quite rare and more comparable to everyday stress among us. They said that the overwhelming response was not that of grief, but was that of relief and happiness. Yet, there's plenty of contradictory information on that. The Elliott Institute, which is a nonprofit pro-abortion institute, anti-abortion institute, did a study in 2011 of women from California, approximately 56,000 women that had had abortions, and found that having an abortion increased their risk of being hospitalized for psychiatric issues by 160%. Again, that's a big number. So to put it into better perspective, of the women they surveyed, 44% of them reported having nervous disorders after their abortion. 36% of them had sleep disorders. 11 of them needed to be medicated with psychiatric medications to deal with the pain of the abortion, and 31% of them regretted the decision altogether. Now, out of all the women in the entire United States that have reported post-abortion syndrome, 60% of them reported having suicidal thoughts after choosing to have an abortion. 28% of them actually attempted to kill themselves, and of those people, half of them attempted 2 or more times to take their own lives. So how can you look me in the eye and say that abortion does not have an emotional impact on a woman? That there is no emotional burden that they have to carry after having an abortion? So we really must ask ourselves, could we have an abortion and not feel the emotional effects of it? Is an abortion a choice that we can just brush under a rug? Even so, does abortion only impact the patient, or does it impact the healthcare workers involved as well? I believe, and after this speech, I hope you believe as well, that once you put aside the political and the religious sides of this debate and look at just the pure emotional impact that abortion has on a woman, that enough could deter you from making the choice and looking at other options so that you can save yourself a lifetime of emotional burden. Thank you.